Hi Joe, I'm Kristen. I'm going to be a physical therapist assessing your wound today.
Okay.
So to start off, we're just going to go through a few history questions if that's all right. How did this wound happen?
I spilled coffee on my arm at work.
Okay. Have you put anything on it to try to help it so far? No.
No.
How long do you think that the coffee was on your arm for this burn?
Probably like 10 seconds.
Okay. And is it painful?
Yeah.
On a scale of 0 to 10, what would you rate it?
Probably like a 7.
All right. And what have you not been able to do since this wound occurred?
I can't volunteer at the soup kitchen. I haven't been able to work and I can't type on my laptop.
Okay. So now we're just going to go through a few things for your past medical history. So it looks like you're in pretty good health other than this going on right now, right?
Mm-hmm.
Before this happened, this burn, did you have any functional limitations, like anything you were limited to do? And it looks like you had your tonsils removed at the age of 10, is that correct?
Yep.
All right. So now we're just going to go through your medication. So it looks like you're on Percocets for pain right now, right?
Mm-hmm.
So Percocets is just a narcotic. It's just to help with that pain. Some side effects that you may have are dizziness, drowsiness, feeling tired, extreme happiness or sadness. You could have nausea, vomiting, stomach pain, constipation, headache, or this is also for addiction. So this can impact your wound healing because the pain medicine is not going to allow you to feel that pain. It's going to help with the pain, so it would allow your wound to heal properly. But also, if you don't feel the pain, it may affect if you touch it or move the wrong way. It may affect that healing process. Okay. So now going through your life, your occupation, your what you do for fun. So you said you were in school.
Mm-hmm.
What kind of school are you in?
I'm a full-time grad student.
Okay. Are there anything like with school that you're having issues with this burn on your arm?
Yeah, like sleep, typing, sitting at a desk.
Okay. And you said you work at a coffee shop?
Yeah.
So you're going to have some exposure to some hot liquids if you go back to work.
Mm-hmm.
And who do you live with at home? Anyone?
Yeah, I live with 2 of my friends on the 2nd floor.
Okay. Of an apartment building? Yeah. And you said you volunteered at a soup kitchen, so you're active in your community. Do you do anything else or just that?
I like to work out, lift weights at the gym occasionally.
Okay, good. Are you a drinker?
Just on the weekends.
And are you a smoker?
No.
No? Okay, good. And is there anything you're having difficult with doing, like in your everyday life?
I can't really use my right hand for like normal things I used to do,
Mm-hmm.
like brushing my hair or grabbing cups out of the cupboard.
All right, so do you have any pain with anything you're doing throughout the day, like anything you're limited from?
Yeah, like things like reaching overhead
Mm-hmm.
and like sleeping.
Okay, good. All right, so now what we're going to do is we're just going to go through your system reviews. So we're just going to assess each one of your systems, and then at the end, I'm going to be doing 2 of these tests on you, if that's okay. So with your cardiovascular and pulmonary system, I'd be checking your blood pressure, your heart rate, your peripheral pulse. So I would do your radial pulse, which is down here on your wrist, capillary refill to make sure that blood flow is adequate down there, and your respiration rate, just to make sure if you inhaled anything with the burn that it didn't get into your lungs, okay? And then checking your musculoskeletal system, I would check your range of motion. So I'll do your fingers, your wrists, your elbows, and your shoulder, just to make sure your whole arm is okay with your range. And going into your neuromuscular system, I would check the sensation, your vibration, proprioception, pressure. So I do a superficial and then a deep pressure test, and your reflexes. So in this case, it would be your tricep reflex. Your gastrointestinal, I would just do a quick nutritional assessment on you because poor nutrition actually can affect wound healing. So I just want to make sure you're getting the adequate nutrients to help with your wound to heal correctly. And in this case, urogenital would not be necessary because you don't have any current or past medical issues with your urogenital system, okay? So to start off, I'm going to check your range of motion. So can I just have you put your arm off the edge of the table here? This is a goniometer. So this is just going to check your range. So wrist flexion is normally 80 degrees and extension is normally 70 degrees. So I'm just going to put this right here on the side. Here. Good. And I'm going to have, just with me, I'm going to have flex your wrist. Good. So you're actually at 73 for flexion. And then extension we got just about 70 watt actually. So now can I have your affected arm? So we'll just compare sides. All right, so same thing. Let me know if you have any pain or any discomfort with this, if it's too much. And push your wrist down like this. To about right there. It looks like we have 74. So that's good. And then wrist extension. Is this okay? So it looks like we have about 69 there. So they're relatively equal. You don't have much limitation in them. So now what we're gonna do is we're gonna check your pulse. So I'm gonna check your radial pulse. I'm gonna do it on this side first if you don't mind. So I'm just gonna hold for 15 seconds and then I'll get your pulse per minute by just multiplying by 4. I'm gonna check your uninvolved side and then we'll check your involved side after, okay? Okay, so I got 16 there, so that would be 64 beats per minute. And then can I have your unaffected arm? Your affected arm? So same thing. Okay, so I got 15, so you would have 60, you're okay, continue. You would have 60 beats per minute on your right side, so they're relatively the same as well. Okay, so now we're just gonna go through the wound exam. So starting with the location of the wound. So it's on your dorsal aspect of your right upper extremity. So it extends from the dorsal hand, just below the wrist, but not getting the fingers or thumb, and extends all the way up to the dorsal aspect of the right forearm, and then half of the dorsal aspect of your arm up in your upper arm area. Measuring the wound, so using the total body surface area, the rule of nines, it is 3.4% of your skin. So I did the dorsal aspect of the forearm is 2.25, and then the percentage of the dorsal aspect of your upper arm is 1.125, which rounds up to 3.4% total body surface area. And then going into the wound bed in percentages. So all of this red, pink, light pink, shiny area, this is the erythema around the burn. So I calculated about 15% of blisters and then 85% of this shiny red erythema, little liquid coming out of it. And the wound edges, so you can only really see the wound edge a little bit up here. It doesn't look like there's any distinct wound edges. It looks like it just goes into that normal skin on the dorsal aspect of the hand. And the peri wound, so around the whole burn, again up here, it looks like it's pretty normal skin there, but the peri wound around these blisters looks like to be that erythema and that red, pink, shiny skin area around each of these blisters. So the exudate is the liquid that is coming out of the wound. So this called serous exudate. It's just clear, watery serum, and it's shown in an inflammatory phase of healing. So you can see all this clear here, liquid, and that will come out of the blisters as well. And the amount of exudate, so it's a moderate amount of exudate. So upon removal of the dressing, there's a clear, watery drainage on the inner side of the wound dressing, and minimal on the outer aspect of the wound dressing. And then there's some drainage on the wound bed after the dressing removal and some drainage after prolonged treatment. So that equals out to moderate exudate. My final diagnosis of this wound would be a superficial partial thickness burn, also a scald burn. Okay, so now going into wound treatment. This wound is appropriate for debridement. The epidermis is impaired to a risk of infection with that blister. So what we're going to do to debride it is we're going to debride those blisters, and it will heal by epithelialization, which is just a part of the process of healing the wound. And the fluid will be drained, and then we can evaluate the true depth to see if there's anything deeper than what we thought under those blisters. The best dressing that I would pick would be a topical antimicrobial medication, and then I would cover that with a non-moving gauze. So what that is, it's just a sheet of gauze, and it won't allow anything, it's non-adherent, so it won't allow it to stick to the wound. That when we take it off, it won't pull any of that good skin that's healing off of it. I would wrap that with a very light gauze on top, just to make sure there's no compression or anything, so we can allow that wound to properly heal. And then once your draining gets a little bit less from the moderate to minimal, we'll do a semi-permeable film. And this is just also used for superficial partial thick burns. And before we do that, we're just gonna wipe the skin barrier before we apply that adhesive semi-permeable film. And then again, I'll probably wrap it with just another light gauze to make sure it keeps in place, because that is a big area, and make sure it's comfortable, because we don't want anything getting exposed to any areas of this. My reasoning for this is because of the amount of drainage, 2, it is a superficial partial thickness wound, so these both apply for that. The non-moving gauze, like I said, will absorb the moderate drainage, and then the semi-permeable gauze, a film, will absorb the minimal drainage. And this is also inexpensive, and I know that you're in college and budget probably is tough, so it is an inexpensive way to help treat this burn that you have. And then, like I said, to secure the dressing, I would do, there's one called a tubey grip, and then there's just a light thin gauze. So either of those, as long as it's not compressing that arm and allowing for room to breathe and the proper wound healing, that those should be okay. So now going into some patient education things. So I just have 5 things to list to help you with your wound healing. So be cautious with liquids at work and try to maybe prevent this from happening again. Be careful with exposure to hot water, so anything from around 60 degrees Celsius or 140 degrees Fahrenheit for longer than 3 seconds, because that will affect your burn and your skin anyways. Be careful with clothing covering the wound, and make sure no pieces of clothing are getting stuck around the wound bed. So even the short sleeve shirt like mine, it may affect and rub up on that top area. Try to find a comfortable place to have your computer or schoolwork, and make sure you're not putting pressure on the side of that arms, because that could affect the wound healing as well as cause more pain for you. And apply moisturizer to prevent the skin peeling, and some vitamin E cream to help with the scar after the tissue has healed. So after that scar has closed, the vitamin E will help with that scar formation. And just some things to think about, some long-term challenges for this condition after the wound is closed that can happen. You can have very minimal scarring. There could be chance of infection, so what we just mentioned was things to prevent that infection. Cellulitis is just an inflammation around that skin area that you could also get, and then chronic inflammation that can lead to malignant transformation is called margaloins. So that's just also something you need to look out for, to make sure you really be careful of that infection, because it could get very worse down into deeper structures of your body. Any questions? All right, it was nice working with you.